Good day, social media family, and welcome to this podcast. This is the second in our pregnancy series. This is not just for pregnant women, every woman out there, and for every man who has impregnated a woman before or intends to impregnate a woman. You need to hear about this. So in this podcast, I'm going to tell you about second trimester scans. So the second trimester is the 4th, 5th, and the 6th month of pregnancy. And when you take a scan within this period, it is a second trimester scan. Typically, second trimester scans are taken between 18 and 20 weeks, but for any special reason, it may be taken before or after that period I have specified. When we do a second trimester scan, typically we would call it an anomaly scan if it is a routine one. Of course, sometimes you take a scan in the second trimester because there is a complication. We will talk about those later. But for routine pregnancy scans in the second trimester, the first reason is to evaluate the baby. You want to look at all the organ systems. Have they formed well? Is there any abnormality somewhere? What is the sex of the baby? What is the baby's presentation? Although that does not matter so much in the second trimester. We also want to look at the placenta, the location of the placenta, whether it is good, whether it is low-lying. We want to look at how much fluid is around the baby. We also would want to evaluate the mother. If she has fibroids, where are the fibroids located in relation to the baby? Does she have cervical issues? Does she have problems with her ovaries? So we are not just looking at the baby, but we are looking at issues that may concern the mother as well. We check the weight of the baby. We compare it to the expected gestational age of the baby to help us decide whether the baby is growing well, whether the baby is growing too slowly, or whether the baby is growing too fast. It is particularly important to evaluate the cervix in patients who have had history of recurrent abortions, because you want to find out if the cervix has any form of incompetence so that the obstetricians would know how to manage this pregnancy. Also, when there are complications in the pregnancy, for example, if the patient is bleeding, we want to evaluate the placenta, we want to evaluate the cervix, we want to find out why the patient is bleeding. If there is pain, we want to look at the baby and the structures in the pelvis to help us decide where the pain might be coming from. If a patient, for example, starts to lose liquor, so you are not in labor, but you start to leak clear fluid, which is the amniotic fluid around the baby, we will need to do a scan to find out if we can find the reasons why, how much liquor is left, the state of the baby. If, for example, you have suffered a trauma, you fell down, you've been involved in a road traffic accident, or you are not feeling fetal movement as much as you should, we need to evaluate the baby in the second trimester. If you are not able to have a scan in your first trimester, then in the second trimester, this scan will establish the viability of the pregnancy, that indeed the baby is alive. It will confirm the number of babies that are growing in your womb. It will give us the EDD, that is the expected date of delivery of the baby. On this note, I would want to thank you for listening to this broadcast about second trimester scans. Join us again as we talk about third trimester scans in our next episode. God bless you.